and the complete. You need to unmute yourself, Dr. Kappor. You have to unmute yourself. Unmute, please, Dr. Kappor. You're muted. Yes, you're on live. You can start whenever we're ready now.
Yeah, I'm ready. I wanted to be co-hosted.
Oh yeah, I'll do that anyway. I'll do that. Just let me do a second. I'll make you and Maniji co-host.
Thank you very much, Shamanji. Thank you.
I like people when demand things, you know, makes my job easier. Thank you.
Namaskar. Jai Shri Krishna, Jai Shri Radhe, Jai Mata Di, Jai Santoshi Mata. Again, Friday. First of all, I apologize if somebody else was doing the session. As I mentioned, I am not fit, but with the grace of Mata Rani and with your good wishes, I recovered a little bit. So I wanted to do my duty. That's why I came back. Okay. It's nice to see you all. Once again, thank you very much for your good wishes. Now, today is the birthday of our PM of UK, Rishi Sunak. So we will start our prayer just asking the Lord to give him long, healthy, wealthy, and prosperous life. And we are going to celebrate also by offering you something at the end of the session. Okay, so let's sit straight. The whole session is towards Rishi Sunak, our PM. Okay. Take a long deep breath from the nostril. Hands are in Dhyan Mudra. Keep your neck straight, spine straight, shoulder behind. Long deep breath from the nostril. Chanting the word Om 3 times from the mouth. Om. Om Bhurbhuva Swaha Tassaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yonam Prachodayat. Om Bhurbhuva Swaha Tassaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yonam Prachodayat. Om Bhurbhuva Swaha Tassaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yonam Prachodayat. Om Sarve Bhavantu Sukhina Sarve Santu Niramaya Sarve Bhadrani Pasyantu Ma Kashtit Dukh Bhag Bhave. Om Shanti Shanti Shanti. आइए बड़ी श्रद्धा के साथ आज का योग अभ्यास करेंगे. Keeping in mind all the precautions. Hypertensive heart problems, severe acidity, severe asthma, severe backache, or you are recovering from any ailment. Ailment come anytime. You're perfectly healthy and suddenly you're ill. So start doing your pranayama. That is going to help us. If you are seriously ill, please try to rest. In 1 to 2, 3 days rest improves our health. But don't miss pranayam, soft, gentle exercises. As I say, go to your classes. Don't miss any class. Even if you can't do anything, you can do little by looking at the other people. You are getting so many vibration, whether you are on the Zoom or whether you are doing classes in the groups, face to face. That is my humble request to everyone. Try to get better. If you are very seriously ill, take a good rest, and then you improve yourself. And coming back there, and I will demonstrate to you how you get better. How you get better. Don't be too negative. ये जो शरीर मिला है ना, इसमें दुख भी आएंगे और सुख भी आएंगे, रोग भी आएंगे और रोग भाग भी जाएंगे. As Swami ji says, Swami ji, namaskar, namaskar, namaskar. योग बड़ा है, रोग बड़ा नहीं. योग बड़ा है, रोग बड़ा नहीं. योग करिए, निरोगी होइए और उपकारी होइए. उपयोगी, that means helping other. And always share your experiences. That give a lot of inspiration to the other also. So that's what the idea of the today's session was. Let's start gently as we are recovering from any ailment. Very, very simple, soft, general exercises to warm up ourselves. So start with your fingers. Go on breathing from the nostril. You are starting Bhadraka Pranayam. Breathing from the nostril, exhaling from the nostril. The question was asked in the beginning by, I think it was one of our regular, that do we breathe out from the mouth? Do we breathe in the nostril and breathe out from the mouth? Yes, we do many times. That is only done after you have done long time your Kapalbhati. Then we do it because we have done too much. So get rid of all the carbon dioxide. Because if the carbon dioxide is too much in the system, that gives us a lot of side effects. Yes, we do that to calm ourselves, distressing, as Shamanji explained very nicely. Go on doing this, very, very gentle. Breathing in and out from the nostril. Again, you are recovering from any ailment. Even the Bhadraka is done at a slow speed. Then slowly you are improving, go to medium. And if you are completely healthy, you are young, you are not suffering from any heart problem, hypertension, or severe backache, you can do even fast. Yes, that is helping a lot. Especially in the morning. Whole night our doors and windows are closed. In the morning, get up, open your door, main door, front door. And if you're lucky, you have a lot of plants in front of you, trees, big trees. Go on breathing during Bhadraka. Do it for maybe 2 minutes and you are activated. Very simple technique. Then take your hands down, up, slowly. Because when we get any infection, whether bacteria or virus, whole body is affected. The joints are giving pain, the ligament, the muscle, all over, pain. Do it very gently. Then you can do like this. Other side. Like this. Very, very simple techniques we are doing, which we do every day. But you have to start slowly when you're just recovering from any ailment. Build up your stamina very slowly. Well done. Now taking your arms up. Breathing in. Breathe out. Breathing in. Breathe out. Breathing in. Breathe out. Breathing in. Try to hold for a short time. Close your eyes. Go your japa, any mantra, any shabad, any dhun. And concentrate on the organ which is giving you problem. My shoulders are giving me problem. So I am taking my full attention to my shoulder. Dhyan Purvak Yog. Complete Yog. Puran Yog. Then other side. At your own pace. Love this body. Come up slowly. Go down. Come up slowly. Very good. Give a nice smile on the face. We are so lucky. We joined everyone. Thankful to Almighty to give us strength, the Shakti. From where the Shakti is coming from, Lord. Whatever his name is, Ram, Sham, Vai, Guru, Mata Rani, Shiv, Shankar, Bholenath. Stretch and squeeze abdominal muscles in to tone up. Hold it for short time. Enjoy every step. One up, hold, stretch. Breathe out and come down. One up, two down. One up, two down. Then from the side, you can start with first arm like I am doing my right arm. Very, very gentle. Having too much pain in the shoulder, in the elbow, the wrist, the fingers. I want to get activated slowly and slowly. Other side. Carry on. You are doing very well. That's the idea. Don't force yourself. Otherwise, your muscles and the joint will get very annoyed and you will be in pain. अब दोनों से करेंगे. Stretch. 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 Well done. Come back slowly. Go on chanting inside. Om Namah Shivaya. Om Namo 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 Shivaya. Well done. Relax. Close your eyes. The body is getting activated. Uja is coming up. The Shakti is coming. Then take your right arm up and bend over towards the left side. Follow your own body. This is giving exercise to most of the part of the body. Your neck, your full arm, your chest, the heart and lungs, and the abdominal organs are also getting the exercise. और कमर जो है पतली हो जाती है इसी से. जितना नीचे जा सको, according to your own stamina. Hold it for short time. The neck movement is also occurring to activate my thyroid gland, parathyroid gland. Take it down. The left one is going up very slowly, and then I am bending over the right side. I am touching the ground. It's not a must for everyone. If you are sitting on the chair, you can touch the side of your chair, but try to practice more and more and try to go down to the ground. The right hand is touching the ground. Stay there for a short time. And breathing in and come up, take the arms down. Very good. Now you can do it at your thymus area. to activate our thymus gland, which is midway from this dimple up to the sternum. Here, the heart level. We are going to activate our thymus gland, which is going to increase my immunity. What is immunity? The one which is going to fight against any bacteria, virus, fungus, and other things take away our sadness when we are having bereavement. Just dig it in nicely and hold it. Release. Down, breathe in, hold, breathe out. This you can do anytime while you are doing anything, watching the television, lovely serial. So many kathas are going on Asta and Sanskar channel. Hold it. Well done. So you're quite active now. There's so many techniques you can do to get activated in short time, like tapping we do. Tapping is very, very important when you're feeling very low. You don't want to do anything. Just start doing tapping. So easy. And there's so many ways you can do tapping, because these Chinese people, they have produced so many things for us, and other simple techniques, starting with your head. See, tap. And you can do your laughter also. That is also going to make me happy and cheerful, increasing the good hormones, dopamine, serotonin, and oxytocin. They are the good hormones. Just go on tapping and laughing. Ah, ha, 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 ha. Come on, you do it loudly. I'm not going to do. Still recovering. Come on, laugh. You are activating your hypothalamus to take away my depression, dementia, increase the circulation in the brain, regenerating my brain cells. As every day we are degenerating, that is losing out, then increasing. Even at any age you can increase. Then for your central nervous problem like MS, multiple sclerosis, Parkinson, and MND, motor neuron diseases, paralysis. Come on. For the hair growth also. We are losing hair. Chumpy. Put some oil on your hair and do your chumpy. Very good. Very good. Ah, 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 ah. Ah, ah. Come down here now. For the neck ache, for any reason you're having neck ache, this will get better. Then do your collarbone, which is here, the bones here, these bones here, below that. Give good tapping there. अपने आप को प्यार करिए. हम मार नहीं रहे, हम प्यार कर रहे हैं. This is our therapy. Upchar. And you want to activate like lungs, having cold and cough. Just do like this, the lung point. Very good. Expansion of your lung to get better function of the lungs. Very good. Very good. Carry on. Then come to the crease here. The crease at your elbow joint, this one. Do this one. They say more than 100 diseases get better if you do that area. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Other side. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Well done. Well done. And you do this one also. Why you do it? For your Nabi Dharam. Displacement of your Nabi. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. When we have displacement of nadi, nabhi, the navel, there's lots of problem. Constipation, diarrhea, you're alternating. And other thing is depression even comes. Any condition, mental conditions are coming with that. Displacement of our nabhi, that is displacement of your Manipur chakra, which is controlling everything, especially the digestive system. Then you come down more. You can do this gently. We have done the thymus gland already. Very gently at your chest. You're more activating your heart and lungs. Then come to the abdominal organs. Here, you are activating in the center, you are activating your pancreas to get rid of diabetes. Activation of beta cells of pancreas, which is giving us insulin. Then the right side, we are doing our liver, gallbladder. The left side, the same level is your spleen for the formation of blood. Then you come down more at the lower part. You are activating the whole intestines, small, large, and especially the left side, the colon, do it. If you are constipated, always do this area while you are defecating, sitting on that toilet seat. Do this. This will activate the function of your bowel and you will open up your bowels. And carry on doing that. Then go down more. You see your groins. There's so many lymph glands are there to activate the lymphatic system. Well done. Carry on. You do more that area which is you are suffering from. Then at the back, at the level is from your navel going back, your kidneys. So we are doing our kidney point. We activate our kidney function, the urea, creatinine, uric acid, sodium, potassium, all the minerals. You can do both. See? Then come down more. But this is the area. Again, you will get rid of your varicose veins, pain in your legs, and you're activating other organs also by doing this. Then do this part, then come to the calf muscles. Here we are having a lot of problem, isn't it? Can't walk too long. Walk short distance, getting pain in your legs. You have to stop. But you have to do every day. This has to be done every day. With a short time, you get so much activity. That's the idea. That's the idea. The techniques which are going to help us do that. Okay. Now we are going to start pranayama. Just relax yourself. Lift up your spine. Hands are in Dhyan Mudra. This is going to activate my brain, increase my concentration, my memory. And this is the one we use for our meditation also. Go on breathing from the nostril. Breathe out from the nostril. Now this is again done at 3 powers, you can say. Slow, medium, and fast. If you're just recovering, try to do it slowly. But this is going to help us to get over your problem. There's no doubt about it. Have faith in yoga. Have faith in yoga. They're the living examples how people are getting better. And with every breath, you are chanting inside. प्रभु का नाम सबसे बड़ी औषध है, इसमें कोई शक नहीं. सभी संत महात्मा में यही बता रहे हैं बार बार. Simran, Simran, Simran. Whatever you believe in, whatever your ish is, मालिक तो एक ही है, हमने उनको नाम दिए हुए हैं। मैं राम की पुजारन हूँ, मैं श्याम की पुजारन हूँ, मैं माई की पुजारन हूँ, मैं शिव की हूँ, तरह तरह। Have faith in your religion, what you believe in. Go on breathing from the nostril, lovely smile on your face. I am going to get rid of my cold, which lowered me down so badly. This virus is pretty bad, you know, it comes suddenly. That is a surprising story. It comes suddenly and give you a lot of problems. Lot of problems. You are getting a lot of, when you start having it, you must have experience. You are just getting watery discharge from your nostril, and it is like somebody has opened the tap for you continuously. Continuously, the discharge is coming, watery discharge is coming throughout. The virus is so virulent. But again, I will say quite humbly, if you do yoga practice, you can get better. Have a faith in that. Simply you have to do just Bhadrika, Alom Vilom, and Kapalbhati and see the difference. As you are getting better, increase the duration. Take a long deep breath in. The beginner, we say do it 2.5 seconds in and out. But if you have been practicing, try to increase the duration to get the more benefit. You are increasing the oxygen level in whole body, every cell. And these cells are very active, you know, very active. Every cell is having 1 lakh to 4 lakhs vibrations going on in them. That's what we are learning now, slowly and slowly. Every cell of the body is important. There's so many vibrations will come, but if you do your pranayama and if you think positive, you will be having all the positive. I want to get better. I don't want to be ill. I want to do my pranayama. I want to go to my yoga classes. I'm not going to miss it. This should be the attitude. Positive. Even if you can't sit down, lie down and do it with our friends. There are so many friends coming every day on the Zoom. Same thing is happening in the classes now. Make sure the whole chest is expanding. I want to get rid of this cough and cold, bronchitis. I don't want to suffer from pneumonia. And Swamiji has taught us so many simple techniques not to get pneumonia. Just go on doing breathing. What is this Brahm? Pran Shakti. This is my Brahm. This is my Guru. This is my friend. This is my Mata. This is my Pita. And this is everything. My Pran. Aushadhi. Make sure the whole chest is expanding. We are doing diaphragmatic breathing. That's why I'm getting the benefit. When you breathe in, put your hand on the chest, one in the abdomen. Breathe in, chest is expanding, diaphragm is going down, and abdominal vessels are coming out. That's why there's some little bulge coming out at your abdomen. And when you breathe out, opposite way happening. Diaphragm is going up, stomach is going in, chest is getting smaller. Diaphragmatic breathing. Our protocol is diaphragmatic breathing. Simple. Logic. The breath will go through your nostril, nasal passages, up to the trachea, then the bronchi, and then both part of your lungs. That's how it is working. That's why we call it thoracic breathing or diaphragmatic breathing. Take a long deep breath. And try to practice this long time. Even a healthy person, they are supposed to do for 3 minutes. And if you're suffering like this cough and cold, which is coming up with the change of the weather, one day it's raining, other time in the day it's sunny, again rain again. That's how we are getting change of your weather. जब ऋतु बदलती है तो प्रॉब्लम्स होती है. And if you are suffering from cough and cold, even when you're lying down, do it. And go on repeating the whole day. Ten to 15 minutes for an ill person, asthmatic, having bronchitis, pneumonia, pulmonary fibrosis, bronchiectasis, even TB, tuberculosis. For your information, Swamiji has produced drug for the TB also, which came only yesterday. TB treatment is also on Ayurveda, which is a big record. Any problem. But again, yoga is the base, what we are doing in the classes. Go on practicing this, get rid of this cough and cold, sore throat. Increasing the circulation in the whole body. Every cell is getting activated. And if the cells are normal, regenerated, they will perform their duty also, what they are supposed to do. Now raise your arms up, rub your palms. 15 to 20 times to generate heat. Hard. Let's say I've got my pain in my shoulder. Then don't lift your arms up. Do it in front of your face or your chest, you know. You can do all the variation yourself. It's not a must you have to raise your hands up. No. Do it 15 to 20 times. And put it on your eyes. Slightly tightly. Feel the warmth going on the face, including your eyes. This is going to get rid of any problem of the eye. Watery eye, discharge eye, burning eye, glaucoma, cataract, double vision. Then once the temperature of hand is equal to your face, open your eyes slowly. You move the hand. Give a good smart massage on the face at the lower eyelids, where we get black patches, especially the people who don't sleep well. They get a lot of black patches there, people suffering from anemia or any other problem of the skin. They get hyperpigmentation there, black patches. So go on rubbing at the lower eyelid, the lateral angle of the eye, the eyebrows. Just we are increasing the circulation of the eye muscles. Temporal region. Take away all the tension. The forehead. Do it pretty hard. This will help you to get rid of your tension. And if you are suffering from frontal sinusitis, as we covered last week, you are increasing the circulation there and get rid of frontal sinusitis. And what else is happening? Anti-wrinkling. There's so many wrinkles on the forehead, all over the face. So you're doing your face yoga to get rid of these wrinkles. And the overhead, nicely, come down, back of the neck, give a good nice massage, and especially this dimple here. This dimple here. All tension is from there. So give a nice massage there with the tip of the finger, and anti-clockwise, clockwise. Take away all the tension. Then come down. Any neck problem, more down. Then one finger in front, one behind the ear. We are activating all the lymphatic system and the vagus nerve. Vagus nerve is the one which is parasympathetic, which cool us down, rest and digest. Good for our digestion also. And as we say, nitric oxide production, which is very, very important. We learned quite a lot about this. The vessels, blood vessels, they open up. No chance of having any atherosclerosis, that is blockage of the arteries. And that's how the blood pressure is going down. No resistance to the blood flow. And for the heart, no heart attack. Good for diabetes. For the brain also. Nitric oxide is affecting all the systems. Then you can do acupressure points, very simple. Pull up your ear. Whole body organs are there. All the problems, headache, migraine, simple type of headache, nausea, vomiting, dizziness, vertigo, menopausal problems. Then the middle part, then the lower part. Hold it at the top and rotate, activating my spleen, my kidneys, my liver, my pancreas. All the organs are there. So put hand inside also, gently, and the outside also. Watching television, go on doing acupressure. Traveling in the car, you are a passenger, do it. We have all the time to do it if we want to do it. Well done. Then come down here for the throat. Having sore throat, you are massaging your throat. Get it out sore throat. And here, your thyroid gland, and behind, parathyroid gland. And there is a vocal cord. Our voice is going down as we are getting old. Paralysis of the vocal cord, which is so common. I've done the thymus, and you can do any part of your body. I will rub my shoulder. I've got pain in the shoulder. Or your knees, arthritis, osteoarthritis of my right knee. Knee is very important. So always do your knee exercises. Go for a walk. Start slowly. 10 minutes, 5 minutes. Then build up to 30 minutes every day at your own pace. Slow, medium, or you can do fast also. Okay. So next one is Kapalbhati. Very, very simple. This is very important for cough and cold, for asthma, plus other organs are activated. You are getting glow on your face when you are doing this. No need to any cosmetics. Do for 10 minutes and you put so many cosmetics, which is not synthetic. They're produced from inside. Kapalbhati. Kapalbhati. Bhati. Kapal means forehead, Bhati means glow. This is the first effect. Then your thyroid gland, parathyroid gland, heart and lungs, and then your abdominal organs. Get rid of your diabetes, liver problem, kidney problem. Lipids level are improving. Then get rid of constipation, which is so common. And lose weight also, rather balancing of the weight. Because sometimes the people ask if they are very thin, they should not do it Kapalbhati. No, you have to do it to balance your weight. Your weight will go up. This is the magic of the yoga practice. It balances completely. Your way of thinking, your way of eating, your way of going out, your way of even dressing up. Changes you completely, your sabhav, your habits. Kapalbhati, full attention is on exhaling. Again, depending upon your condition, slowly or with medium speed, and don't do fast unless you have a good practice and you're not suffering from any serious ailment. And other disadvantage, if you do fast, you can't do for a long time and you will get pain in your back. But sometimes we are quite active, we do fast also, depending upon your practice. We do various mudra or acupressure in this. Acupressure and mudras are giving us medicine. So today we will doing few mudra and few acupressure points also. First one is your Vayu mudra. Lift up your spine, relax your body and the mind. Put it on your lap. Full attention is on exhaling. We are breathing, of course, we are breathing. Breathing in and then we are exhaling. Now, this is the best technique. If you are suffering from cough and cold, try to do long time, just Kapalbhati, Bhadrika, and Alom Vilom, nothing else. Spend more time and see how much these nasal passages will clear up. I'm talking about simple cold, which is affecting us so quickly with a short notice. So try to do that. Go on doing Kapalbhati with the Vayu Mudra. This mudra is very significant mudra. Take away pain anywhere, whether that is your arthritic pain or headache or menstrual pain, any type of pain anywhere. And increase your digestive power also by activating the Jataragni. Digestion improves. At this stage, we are finding that we have not much appetite. We'll eat little amount of food and we feel very full up completely. So this will increase our fire, which is going to digest my food. One stroke, 1 second. Keep in mind all the precautions, please. Hypertensive heart problems, severe acidity, severe asthma, do it slowly. And if you have any major surgery, don't do for 4 to 6 months. Even after minor surgery, consult your yoga teacher or physician. When to do it, which one to do it, and how long to do it. Bleeding from anywhere, don't do it. You are pregnant or trying to get pregnant, don't do it. Severe headache, don't do it. Minor headache, please do it. Even when you have cough and cold, you get a lot of headache. Again, these sinuses are affected. So, you have to do Kapalbhati for a long time if you want quick recovery. There's no other medicine in allopathy. Yeah, you can take lemsip and this and that. But again, our yoga practice is showing us we want to go to the cause of the problem, not the symptoms. You have to develop that confidence. You can take paracetamol. Swamiji doesn't recommend. No. They have made their own anti-fever drugs known as fever grit, which is not available here, by the way. Okay, this is new production. So follow your pranayam, I think. Have lots of drinks, warm drinks whole day. You can have lemon, honey, and go on chewing your black pepper and mishri. And if you got malatti, licorice, that's also. Try to have a lot of hot drinks. Soup you can have. There's not much appetite in the beginning. So make sure you're having enough fluids going in. That will help you to recover. Come on. One stroke, 1 second. Do very slowly when you're recovering, slowly and slowly. With full faith. I want to get better. Get rid of this cold. Positive thinking. You can have honey and lemon. You can put ginger. Ginger also will help us. Tulsi will help us. Tulsi Mata ki jai. Tulsi Mata ki jai. Go and do your japa inside. Om Namah Bhagavate Vasudevaya. Or you can do Chapai of Ramayana. Deen Dayal Virad Sanghari Haro Nath Mam Sankat Bhari. Deen Dayal Virad Sanghari Haro Nath Mam Sankat Bhari. दीन दयाल विरद संभारी हरो नाथ मम संकट भारी. जय सिया राम जय जय सिया राम. जय सिया राम जय जय सिया राम. Carry on. Change the mudra now to Apan mudra. Taking the tip of your middle finger, the ring finger with the tip of the thumb. And you can do your exercise also. Neck movement, shoulder movement, chest movement, abdominal movement. Carry on.
We can't hear you, Dr. Kappor ji.
Toxins there in the body. Lot of toxins. The brain, negative thoughts, enmity, anger, depression, dementia. Why people are suffering dementia? The brain cells are not working properly because of various conditions which they are suffering. Thyroid problem, diabetes, hypertension, not talking, introvert, completely quiet. That's why there are so many now groups formed where they are doing singing, dancing, talking, chatting. That's what we make them do, not to get dementia. Okay, the next one is your Apan Vayu Mudra. Vayu Mudra and Apan Mudra. This is a very good mudra, lowering the blood pressure, get rid of this breathlessness and detoxification, like our Apan Mudra. get rid of all the problems. Well done. The next one is Pran Mudra. This is the strongest mudra. It is going to flow my pran all over the body, give me more strength, good for my vision. You want to increase your pran shakti when you're suffering from any ailment. So do this mudra, simple, touching the tip of ring finger, little finger with the tip of the thumb. Kapal Bharti with pran mudra. Make sure the whole abdomen is moving, the upper part, middle, and the lower. And take your mind to the problem you're suffering. Arthritis, that particular joint where you're having problem. Diabetes to your pancreas. Liver problem, fatty liver, cirrhosis of liver, hepatitis, liver cancer. Take your mind there. ध्यान पूर्वक योग, धारणा के साथ, धारणा. The spleen, or take your mind to the Manipur chakra, which is going to cover all the digestive system. That is at the level of your navel, Manipur chakra on your spine. By doing this prana and various techniques, we are activating all our 8 chakras. Dhyan Purvak, take your mind to the umbilicus, navel, nabhi. In Punjabi, call it dhunni. लंबा टाइम करना है अगर ठीक होना है तो. This is the only medicine left now. Carry on. You're doing very well. Very well you're doing. We get a lot of pain in our shoulder and the neck. Yes. So do Ganesh Mudra. Hold like this. Shri Ganesh Ainama. With the chanting of Shri Ganesh Maharaj. With this Anayak, taking away all the problems of the life. Kapal Bharti with Ganesh Mudra. Shri Ganeshaya Namah. Shri Ganeshaya Namah. Shri Ganeshaya Namah. And try to do for longer time, not just 5 or 10 times. Go on doing it. I want to get it up my shoulder pain. Plus my respiratory problem also. My asthma. Having a lot of backache, isn't it, when we are suffering? So, Meridian Mudra. Thumb is up. Do Kapal Bhati. The prana is flowing nicely. Come up to down. Lift up your spine. Then there's a lot of muscles and ligaments around it, our spine. So we take outside, the outside muscles and the ligament to activate them. A lot of pain we get when we are ill for any reason. Backache, shoulder pain, pain. Then take inside for the internal muscles and ligaments and all that spinal cord. Then you take down. Now it's prana is flowing from down to up. This is known as spinal mudra also. Let's say I've got too much pain all over the body and I don't want to take paracetamol. Yes? Do your acupressure, get rid of the pain. The area is here, this area. In between your the web here, index finger and the thumb. Press this point, the slight dimple there. This one. Press that. Pain will go wherever the pain is. Because pain comes with everything, whatever you're suffering. And do your Kapal Bhati. Both the sides you can do it. Pain anywhere. After suffering from cold and flu, we get sinusitis, as I explained last week. So we'll do all the sinus points. They are just below here, not the upper part, a little bit below this area, in every finger and in the thumb. So we press it hard, like this. Press it hard and do Kapal Bhati. Go on pressing hard to activate all the sinuses. They will be affected soon, that is the cold works like that. First water discharge, then the purulent discharge will come, thick discharge, maybe yellow color, infection, that is more bacterial. Virus is mainly watery going on. Drink a lot of water and try to eat some food also, light food. You get energy from the food. Press hard. I want not to have sinusitis. No. Having cold. First come cold, then come sinusitis. That gives you a lot of problem. Headache, smell, bad smell, pain in your sinuses. Wherever you touch, there is a pain. Take a lot of herbal tea. The ordinary tea is not going to help us. That is rather so many bad effects. Herbal tea. You can make your own, so simple. No problem. Carry on. Sinus acupressure. Well done. Now you can do your chakki asana. Gentle physical exercise, some simple asana you can do when you are just coming out from the problem. Don't do too much strenuous. Simple. See, depending upon what the disease is, we are focusing more on that. Clockwise, anti-clockwise, with a smile on your face. Come on, young girls, come on, boys, come on. As many times you can do. This is the best one to lose weight. There is no other way. Healthy diet, walking and doing these exercises. Chakki asana. Come on. People are doing for thousands times. Chakki asana. Then the churning. They are doing churning. We want to have charge, which is very good for my colitis. Come on. Move your legs also. And go on singing also. तुम करो प्रभु से प्यार अमृत बरसेगा तुम करो प्रभु से प्यार अमृत बरसेगा भाई बरसेगा भाई बरसेगा तुम करो प्रभु से प्यार अमृत बरसेगा दया धर्म से प्रीति कर लो दया धर्म से प्रीति कर लो भव सागर से पार उतर लो भव सागर से पार उतर लो तेरा हो जाए बेड़ा पार अमृत बरसेगा तेरा हो जाए. Now spread your legs, touch the feet with the opposite hand. Come on, do it 1,000 times if you want to get better. There is no other way. To balance your weight, you are activating all internal organs, the shoulder, the arms, the neck movement also. You are doing your neck exercise. Automatically, you are doing your neck exercise. Carry on at your own pace. Very good. Very good. Very good. Oh, you're very strong, bhaiya. You're very strong, you people. Because you are doing religiously for the last so many years on the Zoom. Credit goes to Shravanji, who has opened this Zoom for us. Just imagine if you are not doing this, what would happen to us? You'll be all depressed and fat, obese, depression. We have got balanced weight now. Balanced weight. Obesity is giving us all the problem. Depression, first of all. Depressed. Depressed, you go on eating without thinking. Compulsive eating. And look for all sweet things, jalebi, gulab jamun, and chocolates. That's what we want to eat when we are depressed. But if you're not depressed, you will think twice. Okay, I want to have one gulab jamun. That's all. Not 3, 4, 5. Just go on eating. You think. Well done. Well done. Well done. Oh, you are very strong, Baba. Okay, relax now. Now here we are saying, breathe in from your nostril and exhale from the mouth. Because we have done so much, we want to de-stress ourselves. Breathe in from the nostril, exhale from the mouth. By doing this, you are doing your facial yoga also. Next one, to get more power from our Prakriti, nature, or our Lord. That's what we do. Breathe in, spread your arms, going up. See? People who are Krishna Bhakta Radha Bhagat, that's what they do. Jai Shri Radhe, Jai Shri Radhe, Jai Shri Radhe, Sham. We are asking the Lord to give us strength. Every step is very scientific. Vigyan Purvak ho raha hai, Vigyan ke saath. Okay. I will do only few asanas because most of us are suffering from diabetes, liver problem, abdominal problems of any kind, constipation. Do your Mandukasana. Thumb in, make a fist, put it at your navel. Breathe in, breathe out, look at the ground, then lift it up. If you can do Kapalbhati, well, that'll be good. Carry on. The legs come up. Left hand at the navel, right at the top. Squeeze your stomach in. Breathe in, breathe out. Go down and then look straight. Most of you are doing Kapalbhati because you are so much now in practice. And come up slowly. I want to activate more my liver. So I put my right hand first on the navel, then the left. Squeeze nicely. Breathe in, breathe out fully. And go down and look straight. This we are supposed to do for a long time. This pose should last more than now 1 minute. And at home you can try up to 2 minutes, 5 minutes, even 10 minutes, if really you are suffering from those problems. What we do on the class is just sort of, I call it demonstration. Time doesn't permit, time flies. If you are suffering from diabetes, you have to do for 10 minutes, one pose, and repeat throughout the day. Empty stomach. Then come up slowly. Then you want to more concentrate on liver and the spleen. Dig it in and do it Kapalbhati. Well done. Next one, Shashakasana. Breathe in, take your arms up. Stretch, look at the ceiling. Then breathe out and go down towards the ground. If you are sitting on a mat, you can touch the ground with your forehead. Then breathe in and come up. Stretch and look straight and bring the arms by the side very slowly. Next one is Yoga Mudrasana. Left hand at navel, right at the top. Breathe in, breathe out. Look at the ground. Here, imagine my chin is touching the ground. This is best done in Padmasana, lotus position. You can do Kapalbhati. And breathe in and come up. The variation is you just sit like this, just for demonstration. Hold your arms at the back. Breathe in, breathe out, and go down. Lot of pressure is coming from your thighs to your abdominal organs. If you can manage to Kapalbhati, do it. Thank you. Then come up. So do some asanas. And if you're suffering from diabetes and liver problem, do only this one. First one, Madhukasana and the Yoga Mudrasana. And then you can do Vakrasana also. When we put our right leg on the left and taking the right hand behind and looking on the right side. This is doing your neck exercise and all the abdominal organs are also getting that. You can do Kapalbhati with this. There are 4 or 5 asanas which are must for us for every day. Then you breathe in and look straight. Other side. We are looking on the left side. You all know, that's why I'm doing a little bit fast now. So that we remember, you know what to do. At home, you have to do it for a long time, 1 minute, 2 minutes, 10 minutes even. One poses. Vakarasana. Well done. The 5th one is your cow's pose. Other side. Well done. So this is what it is. Whenever you're suffering from any problem, especially abdominal problem, overweight, these 5 poses, if you do, that is more than enough. Next week, we'll cover others also. Next, very important for the recovery, your Alom Vilom. That's what you're going to do for a long time. To open up all these nasal passage. Because this virus is coming soon to everyone, I think. Especially they say, don't go out, don't go out. You have to go out. That's how I caught it. That's how I caught it. I knew I am going to get it. It was a meeting, small room, too many people were sitting on each other. And we were not wearing masks. So my humble request is, please, if you are going those places, wear a mask. I'm going to avoid going to those places now. No, I'm not going. I'm going to just send my apologies every time. The room should be adequate. Now we are doing now classes. We have got in big halls, where we are working. And some places there's so much green and light, air. So this is very important. I've learned my lesson only 3 days ago, what I did. But I wasn't aware because I went after a long time there. So please watch out. Going to crowded places, wear a mask. And where you can avoid going, don't go. Don't go. Still COVID is there. Luckily, I didn't have COVID. That's why I didn't come to the class. I had to close my another class on Thursday because I didn't test myself. And I was suffering so much. I said, not going out till I test myself. So COVID is still there. So this is my humble request to everyone. See, at this age, our immunity is very low. And we catch it very quickly, very quickly. But if you do pranayama, your recovery will be fast. No doubt about it. Alom Vilom, Badrika, Kapal Bharti, just do that only. If you can't do any poses because your body doesn't allow you, you are still suffering. So do this religiously. Alom Vilom, Kapal Bharti, long time. Have a break in between. So let's do now Alom Vilom. Another tip is, as your passages are still blocked, do every nostril for a long time. Like close your right nostril, breathe from the left nostril. And exhale from the left nostril. Go on breathing. Open up because there's so much blockage there. There's so much inflammation. Those mucous membranes are just inflamed, and there's a blockage on the way, So close your right nostril, breathe in from the left. And exhale from the left. Do this many times. Long deep breath in and out. The same duration, maybe longer when you are exhaling out. Okay, this one is open now. Now I will do my right one. Breathe in. Breathe out. From the same nostril we are doing, not alternate as you do in Alom Vilom. The same one. First we want to open up. And this happens to everyone, whether you got infection or not. One nostril is blocked, other one is not blocked. So we should always do this in the beginning, I think. लंबा गहरा सांस भरिए और छोड़िए. उसके साथ ओम का जाप करिए. खुल गए दोनों, खुल गए इक्वल. आप करेंगे लोम विलोम. Long deep breath in. Slowly, 2.5 seconds, 5 seconds, 7 seconds, 10 seconds. Carry on. Deep. Slowly. This is going to open up all my respiratory system, the upper respiratory tract, the lower one, it opens up completely. Once this is open up, there's no problem. As the things are working much better now, the next one you can do is your Nadi Shodhan Pranayam, where we are holding our breath. Okay? Close your right nostril, breathe from the left. Hold your breath. Then close the left nostril with these two fingers, middle in the ring, gentle pressure. Exhale from the right. This will only come when these passages are clear up. But if you are suffering too much, discharge is coming and you're feeling feverish, you might not be able to do it. Slowly and slowly. Now, Nari Shodhan is very, very important for increasing the immunity. Autoimmune diseases. And when you're getting this all closed upper respiratory tract, breathe in, hold for a short time. But again, if you're suffering from heart problems, severe or severe hypertension, don't hold it. And these are all preventive methods also, not to get the problem. Alom Vilom is the one which is going to cover all the problems. Opening up all the nadis, all the blood vessels, the capillaries, not to get the problem, any headache, any excessive water in your body, get rid of that. Even the skin problems, heart problem, open up the channels of the heart. Respiratory, of course, we are talking, I think, from the beginning of the session. And then increase the good hormones. Give us positivity in life. Change our habits. And controlling all the organs, your liver, the lipids profile, the kidney profile, your blood even, but one has to do for a long time. People are getting rid of anemia even by doing pranayam for a long time, long time. Plus be careful what you eat. So this is very important. Next one is our Bhamri. We will do 3 times, which is going to give us more Shanti. Udgit pranayam 3 times. Pranayam, be in the state of silent meditation. Moan ki avastha mein hai. Fix your mind either on your breath or the third eye. Go on chanting the Lord's name inside. Any name, any shabad, any dhun, any mantra, any shlok. And repeat inside, I am never alone. I am not weak. The Lord is with me all the time. Give us so much strength. So much strength. We are thankful to Almighty who gave us strength to do our yoga practice. Thank you, Lord. Thank you. Thank you. Raise your arms up. Rub your palms. Put the palm on your eyes. Slowly open your eyes and then try it. So there we are. You can do your Singhasan. That will also open up your throat, but don't do too much if you are suffering from respiratory tract problems, especially the upper one. Do it, you do it, please. Twice only. Ah, ah, ah. Well done. Then give a nice massage. Now today is our Prime Minister's birthday, isn't it? Rishi Sonic. See, so young, you know. He looks like a child to me. So we are going to celebrate his birthday by having dates. You can all have it. This is prasad for you. Date prasad. And barfi for you. Barfi. This is barfi. For all of you. And we are going
Thank
to
you very much.
It's too
this
sweet.
is Mansik because I wish you are with me. Then we can have share it. But now just imagine. This is Mansik prasad.
मुंह में पानी आ गया.
मुंह में पानी आ गया ना?
हाँ जी.
बस खा लिया
Yes, खाइए. बड़े प्यार से खाइए. Dates खाइए. Which is very good for everyone. Dates. We all know that.
खा लिया हमने खा लिया. Thank you.
सबने खा लिया.
So
we are going to sing now happy birthday everyone. Happy birthday
to you.
Happy birthday to you. Happy birthday. Open up, open up. Open up everybody, open up. Happy birthday to you. Hazaaron saal saal ke din ho, 50,000. Come on, you sing now.
हजारों साल के दिन हो
तुम जियो हजारों साल के तुम जियो हजारों साल loudly sing loudly please तुम जियो हजारों साल के दिन हो 50,000 Happy birthday to you. Happy birthday. Happy birthday. Our Prime Minister, we are proud of you. We are all proud of you. Ishi.
Hooray. Whip hooray.
Hooray.
Hooray!
Hooray.
Thank you, Dr. Kappor ji. Hope you're feeling
Thank
better.
you,
Hope you're feeling
Kaushalya.
well.
And
Well done.
thank you very much, Dr. Kappor.
जिनको नहीं मिली बर्फी वो आप खा सकते हो. There's plenty here बर्फी. Bharfi
Mhm.
plenty. Come on, everybody.
Thank you.
And dates.
Thank
And
you,
dates
Dr.
also.
Kapoor. Thank you.
Dates are allowed.
You.
Dates.
Thank you.
खाओ खाओ खाओ.